This is really the backbone of patient care. Moving patients quickly through the system provides a much safer environment for patients.
This technology is about improved patient flow and improved patient care. Because we have the picture of the whole facility, we're able to place the patient in the most appropriate clinical unit.
Because they are the most traveled individuals in the hospital, patient transport personnel and EVS personnel have the capability of contributing to the spread of infection if not properly informed and if they don't follow proper technique.
The automated systems that are available now will automatically notify the transporter or the housekeeper of any epidemiology issues when they receive the information for that transport or for that room clean assignment. The problem becomes on the return. The patient is now sitting down in a treatment area. Chances are the same person is not going to return that patient to their room. So what will happen is when that person, the next transporter comes down, picks that patient up, they don't realize that there's an epidemiology issue till they return to the floor and see it posted in the patient's room, and then it's too late.
Exposure for environmental services and transport personnel as well as nursing staff can be a very serious problem. If they don't know and then they go from patient to patient, or transport who takes patients throughout the hospital, with those patients coming in contact with other personnel, it does increase a lot of risk and will have spread more infection throughout the hospital.
We've utilized our technology to enhance our infection control practices by giving our infection control nursing staff direct access to the system. They input data into the system to indicate to us, what kind of precautions need to be taken. One of the great things about the system is that it does convey that information to people who might not otherwise have that information, such as patient transport and the housekeeping personnel that are cleaning the beds.
TeleTracking XT allows us to select isolation attributes at the time a bed is requested for a patient. From the drop-down screen, the staff are allowed to select and can select what isolation, whether it's MRSA, VRE, or none, that applies to that patient. We have made a hard stop at Methodist Healthcare that is a field that must be filled out in order to request a bed and in order for a bed to be assigned. We're automating the knowledge of a hospital-acquired infection or a potential. And then now that knowledge is shared across with EVS and with transport by the interface of TeleTracking, that when the patient is discharged or with every patient move, the attribute follows them. So now EVS and transport will know ahead of time that they're walking into a room that possibly has an infection. Hospitals should use this because it does let everybody know what they're coming in touch with. It helps with decreasing the spread of infection and increasing everybody's awareness.
And for us, patient care is what we're all about, and this technology allows us to be there for that.